How would you know if you have a subluxation that's, How would you know if you have a subluxation that's causing your symptoms or maybe leading to symptoms or disease in the future? It's silent, but it's not invisible. Just like a good detective who can find the culprit by analyzing the clues, your subluxations leave clues, even before they cause your symptoms. Hi, this is Dr. Hobbs, restoring hope and health for lifetime family wellness. Subluxations are silent, especially at the beginning, but they have signs that we can detect with careful evaluation. We look for these silent subluxation signs in our structural and neurological exam. This is what chiropractors are uniquely trained to do. I guess this stands for Chiropractic Subluxation Investigator. So what we look for as signs of the subluxation are tenderness when the area is touched, muscle tension or spasm, sometimes swelling or heat differences because of the blood flow changes, fixation, which is restricted joint motion, and nerve interference. Now, I love working with athletes because they are super attentive to their bodies and they recognize these symptoms early. But even in that case, they're still, the symptoms and the subluxation has already been present for a while. The symptoms have already begun. The longer the subluxation is present, the more the body tries to compensate or compromise. And once it festers long enough, it manifests as symptoms that anyone notices, like pain, tension, heartburn, digestive problems, migraine, numbness, etc. Now, often people start with chiropractic because of those symptom problems, but they continue because they don't want the subluxations to fester until it reaches a symptom point where it may already be contributing to disease. In our office, we perform the structural and neurological exam. In this exam, we're looking for structural, chemical, and mental or neurological causes that may have caused the subluxation initially and may be contributing to their persistence or their return. And we look for those causes by taking a thorough history, x-rays when needed, and digital foot scans. Now, we look for neurological signs with measurement of bilateral weight scales, distribution, heart rate variability, which is a special autonomic nervous system function test, eye movements, balance, gait, and many other functions. And finally, and often most valuably, we assess for both structural and neurological signs with our hands and our eyes. And after years of studying anatomy in books and dissections, and decades now of applying that understanding to feeling the movement of people's muscles and joints, how their bodies move, I can interpret the spine like a blind person reads Braille. Even young chiropractors can do this. It just gets better with experience and understanding. As a summary, how would you know you have a subluxation? The reactive approach, what many people do, is wait for symptoms, and then they can pretty well be sure they have a subluxation. Or the proactive and preventative approach, what more and more people are beginning to do, have your spine and nervous system checked by a chiropractor. In the next video, I'll share what to do if you have a subluxation and how to get rid of them faster and help prevent the return. If you'd like more videos in this series called 12 Things Every Patient Should Know, text the keyword 12 things, that's the number 12 and the word things with no spaces in between, to our office phone number. If you're not a patient, feel free to give us a call, make an appointment. We'd love to help you out, or go on our website and learn more. Have a wonderful day.